10:34 right now, and today in Your Health, we're talking about a new cosmetic surgery procedure that some consider controversial. It's called double eyelid surgery and has become quite popular with Asian women. Alina Cho has more. Also, we do want to warn you that this is a medical procedure you're about to see, so it could be quite graphic to you.
Annie Chang is 23 and beautiful. She doesn't think so yet.
Do you think you're pretty?
Not bad looking. I wouldn't say like really pretty, because my standard is pretty should be having big eyes.
Annie's features are typically Asian. Her eyelids are very small, almost non-existent, and that makes her eyes look small. But all of that is about to change.
And that's very unique to Asians.
Soon she'll undergo surgery to make the folds or creases in her eyes bigger, to create what's known in the Asian community as double eyelids.
In general, I think double eyelids makes you look prettier and makes your eyes look bigger.
The man who will perform the surgery is Dr. Charles Lee. Lee is an expert in plastic surgery for Asians.
Well, this surgery is to Asians what breast augmentations are to mainland Americans.
To better understand it, we had Dr. Lee take a look at my face.
First of all, I guess, tell me how my features differ from Caucasian features.
Sure. The most common or most obvious thing is the upper eyelid.
Lee says my folds or eyelids are small.
And some Asians have larger folds, which if you open your eyes, might be set something like that. And this would be an Asian appearing. This would be an Asian with a larger fold than you have currently. Caucasians have a fold maybe way up here. What I would recommend for your eyes is bury some stitches and stitch your crease slightly higher, and then relax your brow now. Stitch your crease a little bit higher, so that your eyes look brighter.
By brighter, he means bigger, which is exactly what Annie wants. She wants to look a little like the Asian actresses she sees on TV and on the internet.
You notice the big eyes?
Yes, I actually really pay attention to that part, because whenever I see a big eye woman, I just feel that, oh, she's really pretty. Back
at Dr. Lee's office, Annie is now getting prepped for surgery. First, she's sedated. Next, Dr. Lee measures her eyelids. The top line, 8 millimeters above her natural fold, is where Annie wants her new crease to be.
I'm just making sure that the markings and everything are appropriate.
The surgery takes about 30 minutes. Basically, Dr. Lee is using stitches to force the skin to fold, creating a new, bigger eyelid, and in turn, a bigger eye.
When I get this stitch buried in there, you'll see that I'm just attaching the internal structures a little higher up.
Creating the crease.
Yes. When you finish this operation, she's still going to look Asian, and she'll be grateful that I kept her looking Asian.
Eyelid surgery was introduced in the 1950s after the Korean War, when women wanted to look more Caucasian to impress American GIs. Critics of the surgery say Asian women who alter their eyelids are turning their back on their ethnic identity. Dr. Lee says that's impossible.
No one's going to mistake them for being Caucasian or African American. They look Asian. So what we're trying to do is preserve ethnicity, and the bigger question is whether the standard of beauty is changing, but that's a little bit different a question than are you trying to change your race.
2 weeks after the surgery, we're back to see Annie again. The first thing we notice, besides her appearance, is that she's happy and confident. Her eyelids are clearly bigger, and with her new eyes, she's doing things she couldn't before, like experiment with makeup.
Right, but now you can see 2 colors. I can even put 3 colors if I want.
Though she feels sexier and more feminine, Annie says she's still the same person she was before the surgery.
I do still look Asian, but with the eyes now, the bigger eyes now, I just feel I look better. It's kind of like conceited to say that, but then I just feel that way.
Alina Cho, Los Angeles.
Definitely gave her more confidence. It's a very fascinating procedure, and here to tell us a little bit more about it and why some patients are interested in getting this done is Dr. Stephen Davis of Davis Cosmetic Plastic Surgery in Cherry Hill, New Jersey. Nice to see you.
Good morning.
So you've done about 100 of these procedures, and it was interesting to watch the piece with you because you were explaining that there are a couple of ways you can do that procedure.
Yes, you can. One of the things that he mentioned, which is why most patients are coming in to have it done, is that they really are trying to beautify the eye, make the eye larger. And one of the chief complaints has been that they can't apply eye makeup, they can't put fake eyelashes on because the anatomy of the Asian eyelid is such that the crease or the fold is much closer to the eyelashes than in other populations.
Sure.
So we're trying to alter that crease to just make the eye open.
Right. It also looked as if the eyelashes kind of come down like this, so you don't see as much of them until you get it up, and then they kind of come up.
And that's
really...
exactly right. The Asian eye that is open has been termed the double eye type of thing, and that's why the surgery procedure is the double eyelid surgery. And the concept is to try to make that fold just a little higher to give the eye a brighter opening.
Right. It really was a dramatic difference, although
really
both
was.
are beautiful. 30 minutes in the operating room to get that done. Is it
It's a same-day surgery.
Same-day surgery,
Same-day surgery. Again, depending on the age of the patient, sometimes all you need to do is just make the crease. Other times, patients are coming in because it's a little puffy. Also, there's maybe a little bit of excess skin, so you can make an incision across the whole eyelid and take away some extra skin as well as some fat at the same time.
How long does it take to heal?
Probably a good week
to
heal.
And as far as medical procedures go, because this isn't something that was mandatory, it was really optional, is it something that insurance covers, or what's the cost on a procedure like that?
Something like this, depending on, again, how extensive the procedure is, could range anywhere between, let's say, $3,000 to maybe $8,000 to do it. And again, sometimes patients also want to incorporate something to the lower lids as well if there's puffiness there.
Right. Have you seen people who have come back in and who have said, the backlash on my changing of my eyes from my community has been big, or?
I haven't seen that, but I think with any kind of cosmetic surgery procedure, you really have to evaluate the patient, sit down with them for a while, and really determine why they're having that procedure. It's possible that sometimes they may be trying to westernize the eye, but just like with breast augmentation, as was mentioned, a lot of times patients come in, and I think the overall misconception is everybody wants to go larger.
Right.
And in reality, it really isn't like that. They just want to retain some shape to it. Same thing with the eyelids.
Yeah, it really was beautiful, and it obviously gave her a lot of confidence, which at the end of the day is the most important, right?
Absolutely.
Yeah. Dr. Davis, thanks for being here. That was fun.
Thank you.
He's a plastic surgeon at Kennedy Hospital in New Jersey, if you'd like to get a hold of him. Greg, over to you.